Hey everyone,
Hey everybody.
welcome to another Travel Therapy Mentor live video. Tonight we're going to be talking about certifications and how they relate to travelers. Last week after our video we got a question about which certifications would help you out as a traveler. So this was a PT asking about which certifications could they get that might help them either get jobs or get higher pay. So we want to cover a little bit of that, talk about each discipline and what certifications might be helpful, and if it does lead to higher pay or not. So Whitney's going to introduce us, and I'm going to get this video shared in a couple different groups.
All right. Hey everybody. Thanks for joining tonight. My name is Whitney Aiken,
And I'm Jared Kazaza.
and we are both traveling doctors of physical therapy. We run the website and the social media page Travel Therapy Mentor, and every week we bring you a different topic about something related to travel therapy and our profession as travel PTs, as well as those of you guys that are OTs, SLPs, PTAs, and CODAs. So as Jared mentioned, tonight we're going to talk a little bit about continuing education. I know this is a hot topic, especially as we approach the end of the year. Rather, a lot of people are wondering about getting their continuing education requirements done for the year. And then there's a lot of people that are looking to get into travel therapy perhaps in 2021. There's a lot of people that maybe it didn't work out in 2020, so they're thinking, maybe I'll get into it next year. And is there anything I can do in the meantime that's going to help me stand out as a candidate as a travel therapist? So we've gotten this question a lot in the past, and we've talked about it a little bit, but we wanted to retouch on that tonight, especially as we're coming up towards the end of the year and the beginning of a new year. So we'll talk a little bit about some continuing education courses that might benefit you for certain settings and certain disciplines, as well as if it's going to make a difference on whether or not it'll help you to get jobs and be more competitive, whether or not it'll help you to get into a new setting, if you're thinking about exploring a new setting, if it'll help you make higher pay. So if you guys are joining in live with us, we would love if you'd say hi in the comments. We'd also be interested to hear from you guys tonight if you would comment below with your favorite continuing education or certification course that you've ever taken. So we'll tell you one of ours that we have really enjoyed. Probably one of our favorite ones that we've done was on Medbridge, which is where we do a lot of our online continuing education. We have done many of Adrian Lowe's pain neuroscience education courses, and we've gotten a lot of value out of that. Those were courses that we felt like really extended our knowledge and our practice outside of just the basics that you learn in your degree program. So those have been our favorites that we've done on the Medbridge website. So we'd love to hear from you guys. What are your favorites that you've done, whether it was online, it was a course that you attended in person, did you get an advanced certification or some kind of certificate? Let us know what your favorite was. And if you're still a student, just say hey in the comments and let us know that too. Maybe you haven't taken any continuing ed yet, so let us know.
Yep. So certifications can vary a lot depending on the setting that you're in, your experience level. So there's a big difference between, getting an advanced certification like a specialty certification and then more of it like a treatment-based certification. So there's a variety of certifications that you can get, which will change things significantly depending on what you're looking for. Is it to stand out as a candidate, or is it to try to get higher pay for a travel job? Those are some of the factors that go into it.
So let's address, will it make you more competitive for certain jobs if you take continuing education in certain areas or get advanced certifications?
Yeah, so for the most part, this depends on the job market. If the job market is very competitive and they have a lot of applicants and you have some certification that helps you stand out, then that's always going to be a good thing. Especially if it's one of those higher level advanced certifications, something like OCS or GCS or something like that. If a hiring manager is looking at 30 different applications and nothing really makes them stand out besides experience, and then you have one person that has an advanced certification that's recognized, then that can definitely help you get a job. On the other hand, if there are a ton of applicants and they just need someone to fill the role for a short period of time, they might not really care that much about certification. So that could be more of like a tiebreaker kind of thing if you have those advanced certifications. But there are definitely situations where the facility and the manager really might not care that much. It might be more about when you can start, if you'll accept the job quickly, the pay rate, and all of those things.
There's a lot that goes into when they're choosing candidates. So sometimes if they really need to get somebody in the door just to fill that void short term, and you have this advanced certification and you think, I have all this experience, I'm a great candidate, but you are not able to start when they need you to start. Maybe you're asking for them to wait for a month, or you don't have the license for that state ready to go. They might look you over for a candidate who has less experience and less certifications just so they can get somebody in the door, which is unfortunate. And a lot of times with perm jobs, it's not that way. A lot of times with perm jobs, they'll wait around for the right candidate because they really want somebody good there that they're going to invest in long term. But it's not always that way with travel jobs.
Yeah, that's an important distinction between permanent jobs and travel jobs. Permanent jobs, they want someone that's a great clinician that's going to be there for a long time. Ideally, they want someone that'll be able to see a high volume of patients if possible. And they know that if someone has invested the time into getting a certification, they're probably a pretty good clinician. Whereas a travel job, a lot of times what they care about, this is not across the board, but a lot of travel assignments, what they care about is getting someone in there that can bill and can do the job for a short period of time while they look for a permanent person that has the qualifications that they're looking for. So unfortunately, a lot of times as a traveler, certifications don't hold as much weight as they might as a permanent employee looking for a job.
Which brings us to the next question of, if you have these advanced certifications and have a lot of continuing education on your resume or your CV, is it going to make it more likely that you could get paid higher as a travel therapist? And we get this question a lot from experienced therapists, especially PTs who have, their OCS or their GCS or NCS, and they've been practicing for several years, and they think they're a really great candidate, and then they're switching from a permanent job into a travel job, and they're thinking, this is great. Like, I've got all this experience, all these certifications. I'm probably going to make a lot more as a travel therapist, right? Like a lot more than the new grads and the people without experience, right?
Yeah, and rarely is this the case because just like we were saying, especially with the job market, how it is now, if a facility has 20 applicants for the job, and let's say 15 of those are pretty well qualified, the facility is not going to pay you an extra $5 an hour for a OCS certification or something like that when they can get someone else in there that can bill the same, even if it's not as good quality of care. That's what, a lot of people with certifications, they feel like they provide better quality of care than people without certifications. Even if that is the case, they're billing the same amount, and that's usually what the facility is looking at. That's, like I said, that's not across the board, but a lot of times they're not going to pay higher for someone with a certification if they have applicants that don't have that will take the job.
Yeah, and especially if they'll take it at the posted rate or sometimes even a lower rate, because again, this is a big distinction between a travel job and a permanent job. The permanent job is going to probably really care about your certifications. They really want to have these high quality clinicians with advanced certifications, and they might be willing to pay you a little bit higher than like a new grad or someone without certifications for a permanent position, because they're hoping you're going to stay there a long time and you're going to really bring a lot of value to their clinic and their facility. However, with a short-term travel job, they just need somebody to kind of fill that space most of the time, so they don't necessarily want to pay higher for someone that has certifications. Now, it's not always the case. Sometimes in certain instances, if it was a position, like especially we see a lot with like outpatient PT positions, where they'll, want to have that right candidate, even if it's only for short term, and maybe they don't have a lot of qualified candidates applying for the job. Maybe back when the market was better and they didn't have a ton of applicants, there were opportunities in that instance for someone that had a lot of experience and advanced certifications to negotiate for higher pay given their qualifications. But lately, because there's just been so many more applicants per number of jobs, they're getting flooded with applicants, so they have a ton of people to choose from. So that's when they kind of are like, well, this person has a good enough resume and they're not asking for more money, so we'll just take them versus the person who is asking for more money because they have advanced certifications.
Yeah, so the takeaway there is that certifications matter more in permanent jobs than they do in travel therapy jobs, and they matter more in a tight job market where there are fewer therapists looking for jobs than in a market where there are a ton of travel therapists looking for jobs. If there's a lot of applicants for the same position, that makes it harder, and it makes it less likely that things like experience and certifications will matter to the hiring manager.
Now, one thing I will say is for certain settings, there's going to be kind of a minimum qualification. So it is going to make a difference if you are, for example, a new grad or someone who has absolutely no experience at all in the setting in which you're applying for versus someone that has the required experience, the required continuing education, or the required certification just at an entry level for the job posted. This would be something more like a specialty position. If the job posted is for a lymphedema specialist and you don't have your certification as a lymphedema specialist, then you don't even meet the minimum qualifications for that job. Or like I saw one the other day for a pelvic health therapist. They needed someone with advanced certifications in pelvic floor therapy to take that job, or like hand therapy or something like that. But these are more rare to see. Most of the time, our travel jobs that we see across the board are more general. You don't see those specialty areas as much, but if you do see those specialty jobs pop up, then that's when it's really going to be essential that you would have the qualifications necessary to take that job.
Yeah. So a time when it really makes sense to have these certifications are when you don't have experience in a setting and you're trying to switch to a different setting. So for example, if someone is primarily an outpatient therapist and they've worked as an outpatient therapist for 2 years and they're trying to get into travel and they're looking for home health assignments, that's a situation where the hiring manager will be a lot more likely to look at you as a candidate if you have put some effort into trying to get a certification or something that will help you in that setting. They want a candidate that either has experience or is trying to get some sort of experience or knowledge about the setting. So that's when, for example, the OASIS is something in home health that can be very difficult, and a lot of hiring managers want experience with that. There are courses that you can take that will give you an idea of how to fill out the OASIS and how to be more efficient with it. And if you can tell a hiring manager, hey, I don't have experience in home health, but I've taken this course, I'm familiar with the OASIS, I think I'll be okay with it, that can mean a lot.
Yeah, this is hugely important. If we were looking to switch settings right now, I would absolutely be doing everything I could from a continuing education standpoint to get some background knowledge, because you can't always get your foot in the door at a job if you don't have experience. But if you can't get your foot in the door, then how do you get the experience, right? Like, we all run into that. It's like you want to transition settings and they want somebody with experience, but how do you get it? So there's a couple of different ways. I know we've talked about before, it might benefit you to like get a PRN job or something part-time in that setting to get some experience, to get your foot in the door for a permanent position or a travel position in that field. But getting these continuing education hours and taking some online certifications in that setting would really benefit you and make you stand out. So in a lot of cases, I know therapists will put this on their resume or their CV and make it a little longer to show that even though you didn't have the work history in that setting, you've taken this online course or gotten a certificate or whatever it is. You put that on your resume, and hopefully that will stand out to the person who's looking at your resume. And then hopefully if you get the opportunity to interview, then you would want to talk that up in your interview. You would want to say, okay, I've been working on this, this, and this to try to build my skills and my knowledge in this area, and I feel confident about it, even though I don't have experience working in that setting yet.
Yeah, that can be very important and reassuring for whoever you're interviewing with.
Yeah. I just want to say a quick hello to those of you guys that are watching live. If you are watching live, again, we'd love for you to leave us a comment. We'd love to hear from you guys. What are some of your favorite continuing education courses that you have done? We're going to talk about some here in a few minutes. And we're really familiar with a lot of the PT ones, and I have done a little bit of research on some of the OT and SLP ones, but we'd love to hear from you guys. I see Allie is on. Hi, Allie. Hey, Armand. Hi, Forrest. Hi, Kristen. Hi, Melissa. Hi, Kathy. Hi, Shannon. Hi, Jenny. Hi, Holly. Hi, Quinn. Hi, Nikki. Hi, Callie. Rosa. Elizabeth. Carletta. A lot of you guys on. Amy, Joey, and Jeff. Thank you guys so much for tuning in. Again, if you're watching live, we'd love if you give us a thumbs up and comment below and let us know you're watching. So we talked a little bit about how it would be important if you were switching settings to get some continuing ed. The other instance in which I think it's really important would be if you're a new grad. So new grads, it's been really tough this year, especially. And so there were a lot of new grads that had maybe a lull between the time that they finished coursework and clinicals before they could take the exam, or another lull after that after they took the exam and passed before they could actually get a job. So some of you guys are having these extended periods of time off where you can't do anything and you're kind of in limbo. I think this is a super important time for you guys to be doing continuing education, doing something to make yourself stand out, because they might look at your resume and say, oh, you graduated in May or maybe December of 19 and you haven't worked yet, and maybe you're not really standing out, maybe you're getting turned down for some jobs. These are some ways that you could boost your resume.
Yeah, there's a lot of new grads applying for travel positions right now, and over the last few months it's gotten a little bit better where we're seeing some new grads being placed in travel positions, but for a while there was almost no new grads being placed. And so right now, say you have a position posted and 10 new grads apply for it, and all of these new grads graduated in May. If you're the one that has a certification, even if it's like a 20-hour certification that you can do on Medbridge or one of these online sites that is directly applicable to the setting that you're applying for the job in, that'll make you stand out as a candidate, and that could get you the job over the other applicants, everything else being equal.
Absolutely. And I think that would also be the case if you're a travel therapist who has experience, but maybe you decided to take a little bit of time off like we do. Sometimes we've taken 6+ months off from work. So being able to say that you were doing something during that intermediate time will help you stand out to a potential employer on an interview if they say like, okay, you took 6 months off, what have you been doing during that time? So if you can say, oh, well, I was taking some time for myself and my family and that sort of thing, but I was also catching up on some continuing education. I took this really great course. I learned a lot about this, and you could chalk that up a little bit and say, how did that improve your abilities as a clinician? Like, oh, I had this downtime to refresh and reflect on how I've been treating this type of patient that I've seen for many years in the clinic, but I learned this new thing in this course, and something like that is a good talking point if you've taken some time off, I think.
Yep, we've talked to a couple hiring managers recently that specifically mentioned that if they see someone that has a long gap in work history, they're always going to ask about continuing education and what have you done to stay fresh, because they don't want someone coming in there that has taken a lot of time off, whether that be a new grad that couldn't find a position or someone that chose to take time off. That is just removed from continuing education and clinical work. To come back in there and try to pick everything back up, it can be difficult.
Yeah. So let's get into talking about some of the setting and discipline specific continuing education that might benefit you when you're looking to get travel jobs and find a way to stand out on your resume and your interview. So as Jared already mentioned, for home health, we think it's hugely important when you're trying to get into home health to understand how the OASIS works. Understand a little bit about how the billing model works. So you might want to research the recent changes in PDGM for Medicare patients. There are some good online courses. We did one when we were trying to learn about what PDGM was on Medbridge. And so I know Medbridge has one. I know there are others out there. We're going to get into talking a little bit about some of the ones that are on Medbridge because that's the website that we use. And if any of you guys have followed us before, you know that we have an affiliate code with Medbridge. The code is Fifth Wheel PT, FIFTHWHEEL PT, and this gives you a discount on your annual membership. I've been using Medbridge for my CEUs since I was back in PT school, actually trying to get continuing education for my athletic training certification that I've maintained since I graduated my athletic training undergraduate degree. So I've used it for like 7 or 8 years. And Jared's been using it for the whole 5 years that we've been out of PT school. So we love Medbridge. I know there's also Summit Education that a lot of people like, and there's tons of other websites.
There's a site called Home CU Connection. We've tried a variety of different ones, and we are always surprised at the quality of content that Medbridge has over the other online sites.
Yeah, so I'm going to get into talking specifically in a minute about some of the ones that I looked up on there today that might really benefit you guys. But the thing we like about a site like Medbridge is that you sign up for a 1-year membership and you just pay the fee for 1 year and you can get unlimited CEUs for the whole year. And with the discount code, it's $200 for the regular membership for PT, OT, athletic trainers, and a couple other disciplines, and then it's $95 for SLP. And then they have different tiers. You can go up, it's like $250 or $300. But we just have the basic $200 membership and we love it. I looked up some other certification courses that are just like a one-time course for one topic, and some of those, even the online versions, can be like $500. So it can be a lot more pricey to do these other types of certifications. But of course, if you're looking to get something like your OCS or GCS or for SLP, like your modified barium swallow certifications, all these more advanced ones, specific manual therapy technique, whatever it might be worth the money to you. But for us, we really like that $200 a year membership to get a variety of different online courses.
Yeah, another great thing about them is they have prep courses for some of these advanced certifications like OCS, GCS. I'm sure they have them as well for OT and SLP. We just haven't been on there for those. Mm-hmm. And we've heard good things about those prep courses if you do plan to go for one of those certifications, and that's included in the price, which is pretty awesome.
Yeah. So I'll talk a little bit more about that in a minute, but for home health, I would definitely recommend an OASIS training course and something about PDGM, because a lot of the employers are like, we understand that you have the skills, like you probably have the clinical skills to do an evaluation, you probably have the clinical skills to do a treatment, but do you understand how the business side of things work? Do you understand how the billing works and how your day-to-day is in this setting versus a different setting? So those are the things I think would stand out the most. For skilled nursing, likewise, I would encourage you guys to, if you're trying to get into skilled nursing and do some continuing ed for that, learn about how they bill differently for Medicare Part A versus Medicare Part B. You would also want to research the recent Medicare changes, which was called PDPM, which happened last year. That would be something that is new. So if you have never been in a SNF or you haven't been in a SNF lately, definitely research the new changes, because that's huge in SNF. They're all about productivity and how you're billing. And the PDPM changes are very important.
Yeah, I've only taken one SNF contract, but that's what I did before I started the contract. Is I took a course talking about skilled nursing billing and how that differs for Part A and Part B, because that was confusing to me going into that setting, coming from primarily outpatient.
So in terms of some other settings, for acute care, you might want to research some neuro type specific courses, or some courses that are specific to your discipline, which we'll talk about the disciplines here in a minute. Same for outpatient. Typically outpatient is going to be your outpatient neuro or your outpatient ortho. So you would want to look up specific courses for skills related to those areas for those settings. So I think we kind of hit home a lot on the PT ones. OCS, which is your orthopedic clinical specialist, NCS, which is your neuro, GCS, which is your geriatric, PCS, which is your pediatric, and SCS, but SCS doesn't necessarily, probably wouldn't help you as much for travel therapy, maybe for outpatient, but I think most people tend to go with the OCS for those. What are some other ones that people will talk about in terms of outpatient physical therapy?
Outpatient, there's Graston as a certification program that some people really enjoy. There's LSVT Big, that some people that work with more geriatric and neurologic populations, I've seen some good reviews for that. There are various taping certifications that some people choose to get. There's things like McKinsey certifications and SFMA, dry needling. So there are a ton of outpatient PT related certifications that you're able to get.
A lot of manual ones too. So a ton of those are going to be more your in-person courses. Whereas, as Jared mentioned, for things like your OCS, your GCS, those, you can actually do a lot of your prep just independently. You don't have to go to an actual course. You just prep on your own. Whether you go through like the Medbridge prep course, or there's tons of other prep courses out there, and then you go and sit for the exam on your own. So you don't actually have to attend a course for those, which is nice. But whereas obviously your manual and your dry needling and stuff, you're gonna have to attend, which is harder to do right now with COVID. It's a lot more difficult to get those in-person courses.
True.
So those would be more of like a long-term down the road, not necessarily like if you're trying to get into travel therapy between now and January type thing. So Jared mentioned the LSVT Big. That can be good for PT or OT, and I actually did research today that LSVT for both the Big and the Loud, they actually offer it as an online course as well as an in-person course. So that's actually really cool. If that was something that you were interested in working with neurologic or Parkinson's patients, you can actually do that one online. So if that's something you're interested in, check that one out. And it could help you stand out. I would say probably in like the skilled nursing setting, in the acute or like the inpatient rehab settings.
Maybe even home health in some situations.
So those could be good ones if you plan to work with neurologic patients and want to stand out in those settings. For OT, we mentioned lymphedema or hand therapy. Again, I think these are going to be more in-person courses, so it might not be as feasible to do, short-term online type of thing. I also researched that, in some settings that they're looking for OTs and SLPs that have certifications and advanced knowledge with feeding, especially for pediatrics. So that could be something that you might want to research if that's a population you're interested in working with. For SLP, some of the more in-person, hands-on ones that you might be interested in getting into would be the modified barium swallow. This is really important for acute care, and then I think in some instances home health and SNF, but definitely acute care. I know there's a lot of SLPs that are highly sought after when they have this modified barium swallow certification. So that might be something to look into if you're an SLP thinking about working in those medical settings. Again, feeding, dysphagia, And Vital STEM is another one that I've heard of for SLP, which again is going to be more your in-person course. Actually, I looked up the Vital STEM one. They do have where it's part online and part in-person, so that's something that you could get started online and then look up when they are offering the in-person aspect of it. So talking a little bit more about Medbridge, because it's the one that we're most familiar with, just to explain kind of the different types of courses that they offer online.
They offer some, one cool thing that we like a lot about Medbridge is they'll have these in-person webinars that count as, so some states, actually Rosie asked a question about how many CEU credits are needed for PTs. Some states, it varies depending on the state, and some states require in-person CEU credits, and those live webinars actually count toward that. They also have a ton of just video-based courses that are pre-recorded, and some of those video-based courses they've made into it's kind of like a certification, a certificate program type thing. I did one, I think last year, on low back and neck evaluation and examination treatment, and that was pretty cool. It was I think it was 20 hours of content or something like that, and I got a ton of CEU credits, and I think it helped my treating. So yeah, they've got webinars, live webinars, and they've got a variety of pre-recorded lectures.
Yeah, I thought the really interesting thing that I had never heard of before were these certificate programs, is what they call them. So these aren't going to be the type of things that someone is going to recognize by name. You know, if you are on an interview with somebody or you put in your resume, LSVT big, like everybody's heard of that. They're going to know that's that program, or McKinsey certified, or modified barium swallow certified. Like, they're going to recognize those names. These Medbridge ones aren't like that, but basically what they've done is they've taken a bunch of different courses and put them all packaged together in like a 10, 15, 20, 30 hour span for you, so you can go through a bunch of different courses, and at the end you can print out a little certificate that says, I completed the certificate program to improve my skills in this. And it's just a little bit more comprehensive way of saying that I have taken some advanced continuing education in this topic. So Jared mentioned a couple of the orthopedic ones. He'd done like the back one and I think maybe the neck one. But I looked up today, they have a lot of interesting ones. So they actually have a full one on vestibular. So if you're a PT who wants to treat vestibular, they have a full 20 plus hour program on vestibular that can help you to review those skills, and that would be a good talking point. They have ones that are called Orthopedic Excellence in blank. So if you're an orthopedic therapist, that can be good for you. They had a whole one on spinal cord injury. So if you're a OT, PT that works in a neurologic setting, they have a huge review on SLP. I mean, not on SLP, on spinal cord injury, which is really interesting. The one I really was excited about, I knew they had an OASIS course, but I did not know this. They have one called Home Health Essentials. And it's literally a 21-hour course, goes through a bunch of different modules, just taking you from A to Z, understanding how home health works, all the way through the billing and creating plans of care, documenting treatment ideas, and all that sort of thing. So if you are planning on switching to home health, which a lot of travel jobs are in home health right now, and they're really competitive to get into if you don't have home health experience. So if you're someone who's thinking about transitioning to home health, I would highly encourage that program, which is just, again, these are all included. Like if you get a Medbridge membership for $200 a year or $95 if you're an SLP, you can take this one plus others plus for an entire year. I know there are other courses out there. There's a lot of individuals. Like we know an individual that has a home health course. We know we've seen lots of individuals that offer courses on specific areas online, and that's definitely an option. But I thought it was really neat that Medbridge offers some of these certification type programs that are comprehensive, just included with your annual membership.
Yeah, I think that home health one is really important. I think almost all therapists right now are considering home health, even if that's not something they really want to do, just because there's so many more job options there for travelers. And for me, for example, I want to get into home health, but I'm kind of nervous about getting in, and I know that there's a lot of home health agencies that don't really want to have someone with no experience in home health. So that certification program is definitely something I'm considering doing for the future if we try to take a home health contract.
Yeah, I would feel like that would definitely make us stand out, and I would use that as a huge talking point in an interview. They had the same exact thing for skilled nursing. Now, I know skilled nursing they're pretty easy to come by, those jobs, and they're not always as competitive. A lot of times they'll take you in skilled nursing without any experience, but for your own peace of mind, it might be important to take that. They have called skilled nursing facility essentials, where it takes you from A to Z on how it works with the billing and managing your caseload, treatment ideas, all that kind of thing. I also saw some for school settings. So again, we have no school experience, but this was kind of interesting. There was one about interventions in early childhood and school for SLPs, working with stuttering, children with stuttering disorders. So that was really interesting. I did not see one on IEPs, but I feel like if you were going to try to get into school, you would definitely want to find some courses on how IEPs work and managing that aspect. Because again, you might understand how to treat the patients and the disorders. You might remember all that from school, but you might not really understand the business side of things. Like, how do I manage these IEP meetings and these reports? That would be something I would recommend for if you're trying to get into school setting and don't have any experience.
Definitely.
Yeah, so that's mostly it. Like we said, we obviously really like Medbridge. It's how we get, I would say, 90% or more of our continuing ed. We do a lot of those pre-recorded courses. We have done some of the packaged certificate programs that they have. We've not used it for certification prep, but if I ever decide to do the OCS, I probably would use their certification prep program, and then I might supplement with a separate program, because I've heard from some people pros and cons. Some people, there's another one out there like for OCS that people really like, but you might use the Medbridge one if you already have the membership, and then just supplement with another program as well to expand your knowledge there. But then I think really important in 2020 and then going into 2021, where it's harder to do these live programs, something like Medbridge or Summit or some of these other ones that offer online live webinars that will count for your live in-person requirements. That's huge, because it's so hard right now to go and do live courses because of COVID. So to us, that's really important. So we have a few comments. We'll go and read through a couple of the comments and questions. If you guys are watching and you have questions, please leave them in the comments. Even if you're watching later on the replay, please feel free to leave comments. We always go back to the videos and look at them.
Alex says, I'm beginning my second year of PT school. Do you recommend travel PT ride for graduation? Traditionally, we traveled as new grads. We had a good experience. I think we've talked to a lot of others that traveled as new grads and had a good experience. There are also people that have a bad experience. In general, we say it depends on you as a person and as a clinician. How comfortable do you feel treating patients, evaluating patients on your own, coming from your last clinical, going into graduation? Just honestly ask yourself, how good do you feel as a clinician? Do you feel like you're 100% independent? And if you are, then travel can be a good option. Right now, so since you're a second year, the travel market's not great. We definitely have seen that pick up, and hopefully by the time you graduate, it will be better, and it should be a viable option for you as long as you feel good as a clinician.
Yep. So Rosie says, can you say what the name of the home health course is again? So the home health course I was talking about is just on Medbridge. It's medbridgeeducation.com. So if you have a Medbridge subscription already, it'll already be included in your Medbridge subscription. If you do not have a Medbridge subscription, you can sign up using our promo code at medbridgeeducation.com. Just when you go to checkout, just use the promo code FifthWheelPT. And
you can go to traveltherapymentor.com/medbridge, and it's there as well.
Oh, that's right. Yeah, we have a link to it on our website there. But once you're into your Medbridge account and you're logged in, if you just click where they have continuing education, and they have what are called certificate programs. So the home health one that I was talking about is under one of their certificate programs. So it's going to be a whole series of lectures, and they do quizzes and all that. And it was called Home Health Essentials, and it was 21 hours of video content that you can take at your own pace, and then at the end you'll get a certificate in the Home Health Essentials. Rosie also says, does every state require continuing education every year, or is it every 2 years, or does it depend on the state?
It depends on the state. Some have way higher requirements than others. I think there are some states, I believe Massachusetts is one of them, that doesn't have any continuing education requirement at all. but the majority of states, probably almost all of them, have some sort of requirement either every year or every 2 years.
Yeah. And one thing I will point out, I think I might have read somebody say somewhere that some of the states were maybe deferring some of their continuing education requirements. I would not be surprised at all if some of the states are doing that for 2020, just given that it's been a crazy year. I certainly would not be surprised if they're waiving the live requirements, given the circumstances.
Yeah.
But just in case, if this still continues to be an issue going into next year, I can imagine probably at least for the first half of the year, it will be an issue. I would still encourage some of those live webinars. We've done that a lot as travelers because it's been so difficult for us as travel therapists to try to arrange our schedules around an in-person course. So we have pretty much always done those live webinars. I have done a couple of in-person courses, and so has Jared, but we mainly use those live webinars to get our live requirements, especially if I think our North Carolina license requires it.
Yeah, North Carolina. I think Virginia does too. It's like 10 or 20 credits every 2 years, something like that, of live courses.
Mm-hmm. Yeah, so definitely go to your discipline and state website to learn more about their continuing education requirements. Ours are usually pretty good about emailing us updates. But don't rely on that because who knows, maybe you entered your email wrong or it's an old email address or something, or maybe they don't send emails. So just check your state's website. All right, we'll see if there's any other questions. Nikki, who is an SLP, says she likes speechpathology.com, Medbridge, and the ASHA Learning Pass for SLPs. Thank you, Nikki, for that. Do you have any specific continuing education that you like to focus on, Nikki? Again, we don't know a ton about the SLP ones. I think it would really depend on your discipline. If you're more working in the school system, you might be working more on language and speech. If you're working more in the medical setting, you might be working more on swallowing disorders and just dysphagia. Kind of same with PT. It's really going to vary depending on your discipline, your setting that you work in.
We already covered that one.
Okay, we already covered that question from Rosie. See if we have any other
I think
questions.
that's all.
All right. Yeah, I think that is all the questions, unless anybody else has any more. Rosie says, thanks, you are welcome. Kelsey says, how do you motivate yourselves to do CUs after a week of work?
It's a good question.
That's a good question.
For me, I think it's really important to take things that I'm very interested in. So almost all of the continuing ed courses I've taken in the past have been something that I wanted to learn about, something that I thought would make me a better clinician, that would help me in the clinic. So I really didn't have a lot of issue with motivation because it was something I wanted to learn. If it was something that I didn't care about at all, that would be definitely a lot harder. So I think search out courses that are interesting to you and that are going to make you a better clinician, going to make you more confident working with patients.
I will also say that being able to do them online makes it so much easier because we quite often will do it while we're kind of multitasking. So we didn't know about it before, but actually Medbridge has an app. And I think over the last year and a half is when I learned about the app, and that has been a game changer because I can just pull up the Medbridge app on my phone. So say I could just be sitting there doing the dishes or eating or something, and I can just have it going on my phone. I've even watched them at the gym before, but it is a little bit more tricky at the gym because you do have to click through the slides. But it's really convenient to do that way. I even tried one time listening to one in the car on the way to and from work. As long as they're longer videos, it's okay, but I did find that it was a little distracting to have to click to the next part of the video while driving. So that's not the greatest part with the Medbridge app, but it is really convenient. So, you can just kind of get them done here and there.
Yeah.
And it's nice because it tracks your progress. It'll just be you can watch 3 of the videos and then it's okay, you're 25% done. And then you can put it down and come back to it later. And you're okay, I need to finish this one because I only did 25% of it. And so you don't have to do it all at once too, which helps.
Yeah, take advantage of the downtime. That's good advice.
Yep, you can kind of use it like a podcast too with the app. You could just put your headphones in or use it in the car or whatever, like you would a podcast.
Yep.
All right, Nikki, who is an SLP again, said dysphagia is a big one, a big focus for her. That's cool. Rosa says, I'm a new grad as of last week in September. Congratulations on your recent graduation, Rosa. My main focus would be travel. Been following travel for a year now. I have 2 state licenses, Illinois and California, the hopes of landing a job after school. However, it's tough, so I have taken a perm position It's been a month now. I've got 3 different travel position offers. What are your thoughts on quitting the perm job so soon? Tricky.
Yeah, it's tough. I think it depends a lot on the situation. I wouldn't, if it was me, I wouldn't want to quit a job really quickly, especially if it's your home area that you're planning to go back to, because that can lead to a bad reputation in the area or burning bridges with that clinic. And, you know, depending on where you're from, there might be limited options. Like for us in our area, if there's only so many outpatient PT clinics, if we started a permanent job at one and we left really quickly, chances are they would be a little upset about that. And, you know, then that's one less option that we have for places to work when we settle down.
Yeah, so there's definitely no like hard and fast rule, but if it's somewhere that you don't want to burn bridges with and you want to keep a good rapport with, I would probably try to stay at least 6 months, especially as a new grad, to get a little bit of work history on your resume, have a good relationship with them, be able to use them as a reference moving forward. And when it does come time to put in your notice, you know, just explain to them this is something that you've been really interested in for a long time. Explain your reasoning and your rationale for wanting to do travel for personal and professional growth. You know, explain that you're very appreciative of the opportunity to work there, and you would definitely love to keep in contact with them about future employment opportunities, but this is something you really need to do for your own personal and professional growth. So be professional about it, but I would say more than likely try to put in at least 6 months. If it's a place that you have no desire to ever go back to, it's not a good fit for you, you're not worried about that, then, you know, maybe a little sooner, but I would say 1 month is a little bit quick.
Yeah, and whether, you know, whether you choose to stay or not, definitely put in a pretty long notice. If you're only going to be at the company a short period of time, 30 days or more, that definitely makes usually the hiring managers feel a little better about the situation if they have more time to find someone to take your place.
Yep. All right. Well, if nobody else has any other questions, we'll just wrap up for tonight. So thank you guys for joining us. Thanks to those that are listening later. I know some of you guys like to listen on the replay. If you listen on the replay for Facebook, just type #replay in the comments. I know some of you guys also listen on the replay on our podcast and our YouTube channel. So please subscribe there if you'd like to hear our future content on the podcast on the YouTube. And again, just kind of to recap, I know there's a lot of online continuing education sources out there. There's physicaltherapy.com, speechtherapy.com, Home CU Connection Summit, but our favorite has definitely been Medbridge. That's how we get pretty much all of our CEUs. We think it's the easiest way. They have an app, they have a really great website, they have a lot of certificate programs, certification prep programs, live webinars, pre-recorded. We think it's super convenient, super easy, a lot easier than trying to schedule weekend courses, especially during COVID, a lot cheaper too. So if you guys are interested in signing up for Medbridge, you can use our discount code. Again, it's Fifth Wheel PT, FIFTHWHEELPT, all one word. And that is good for any discipline, PT, OT, PTA, CODA, SLP, athletic trainer, strength and conditioning coach. I think even nursing stuff they definitely have nursing stuff too. So you can use that code across the board for all the disciplines.
Yep. Thank you guys for watching. If you have any video ideas or questions, feel free to send us those either through email or even leave the comment in this video. We're always looking for new ideas of video topics to talk about.
Yep. Thank you all for joining us and have a good night.
All right, bye.